The term euthanasia originates from two Greek words, eu and thantos, meaning good death. Euthanasia, however, is the first step down a long slide into moral chaos. A well-known editor from the School of Reform News has stated that new research showing brain-injured patients, whether comatose or minimally conscious, may have a good deal more awareness of their surroundings than most doctors realize. Dismissing their case would be futile, a slippery slope that could eventually and lead to legalized murder. Justifying euthanasia on these false claims based on the quality of life rests on the assumption that it is possible to make a reasonable judgment of medical futility. Of the 2,700 predictions, 1,226 were off by more than 6 months, and 488 were off by more than 12 months for predicting survival in individual patients with cancer. Patient autonomy was developed so that patients could participate more actively in a part of their care and not their destruction. However, for a medical professional's ethical duty, it may require that they deny a patient's request for something. For example, in the name of autonomy, one should deny a person's request to sell him into slavery as a means of paying off a debt. In Holland specifically, 19.4% of deaths of that country every year are a result of euthanasia. 11.3% of the total number of deaths each year are cases of involuntary euthanasia. That's showing that the fact of the matter is that it is always cheaper to kill than it is to cure. When life presents one with suffering, to abandon it is naive. Thinking about long-term effects and not just immediate ones tells us that one should not open the can of worms that is offered to as within the euthanasia issue. More than 2,000 years ago, Hippocrates placed an absolute prohibition on euthanasia for all who would take up the art of medicine. He saw that it allows intentional killing of innocent life, and it opens a door that cannot easily be closed. Once people allow legal euthanasia, even what is seen to be as in extreme cases, they're setting a precedent for healthcare providers, which says that it's not always necessary for them to do whatever they can to save said person's life. A specific MD, professor of medicine and medical ethics at Georgetown University, Edmund Pellegrino, wrote, "If terminating life is a benefit, the reasoning goes, why should euthanasia be limited to only those who can give consent? Why need we ask for consent?" The Declaration of Independence says that we should have the right to pursue life, liberty, and the pursuit of happiness. Nothing in it says that we have the right to pursue death. Since a person's autonomy requires that he be alive in order to exercise it, a request for euthanasia may be the best example of a request that one has a duty to refuse.